All right. Well, good morning. Yep. Good morning, everybody. We're just trying to figure out what time zone we're all in right now. So I'm State Representative Jonathan Singer. Thank you all for being here, from coming all around the world to gather here in Denver, Colorado's capital city. If you're new to the Mile High City, my only word of warning is don't overexert yourselves physically and drink lots of water. And that's just been the way I've been doing things since the time I moved here 30 years ago, and it's been great. So today we're joined by an excellent panel of one. Why don't the rest of our panelists come on up now as we're beginning? And we're here to have a conversation about the state of marijuana around the country. So as many of you know, we have state regulators with extensive experience now regulating the marijuana industry in the United States. And so we want to be able to get that 10,000-foot view at the 5,280 feet that we're at today. And so we're joined by 4 panelists here, and I'm going to let them actually introduce themselves partially as a mic check to make sure that it's working. But we'll start with Lori Ajax, who is the chief of the Bureau of Cannabis Control in California. So everyone, please welcome Lori.
So I love that introduction. I was just going to leave it at that, but I'll say a little bit more. Hi, good morning, everybody. Thank you for having me here today. The Bureau is charged with implementing the state regulatory structure at the state level for cannabis. As most of you probably know, we have like a dual licensing system where it first has to be approved at the local level and then the state steps in. We have 3 different licensing authorities in California: the Bureau, the Department of Public Health, and Food and Agriculture. Food and Ag handles the regulation of cultivation. Public Health are manufacturers. And then the Bureau rounds out the rest of regulating the distributors, our retailers, our special cannabis events, the testing laboratories, and our micro businesses. So that is what I'm charged with.
All right, next up, and thank you for joining us. Well, we'll keep going on the California side of things. So Nicole, Elliot, the Senior Advisor for the Governor's Office of Business and Economic Development. So thank you for joining us, Nicole.
Thanks for having me. I'm excited to be here with you guys. So as you mentioned, I serve as the Governor's Cannabis Advisor. I am situated in the Governor's Office of Business and Economic Development. Previous to this role, I worked for 10 years in local government, serving 2 mayors, including then Mayor Newsom, as well as 7 years for Mayor Lee, and was tasked with standing up the local office of cannabis in the city and county of San Francisco post-passage of Proposition 64. So standing up that office as well as developing San Francisco's regulations and implementing them.
All right, and next up, let's see if I get this right. Is this Axel? Yeah.
That's Andrew.
Andrew. Both start with A. So Andrew Brisboe, and tell me if I got your pronunciation of your last name correct, the Executive Director for the Marijuana Regulatory Agency for the state of Michigan.
You got it right. Good morning, everyone. As you said, I'm the Executive Director of the Marijuana Regulatory Agency in Michigan. We're under the umbrella of our Department of Licensing and Regulatory Affairs, and we handle all things marijuana in the state. So we have the Registry card program, as well as the commercial licensing program for medical facilities and soon-to-be adult use facilities, as we call them, in the state. So we deal with all issues of public health and safety, licensing processes, disciplinary processes. Tax collection is the only piece that's over in our Department of Treasury. So we're sort of the hub of the wheel, as we like to say, when it comes to determining standards for the facilities and enforcing all of those standards as well.
All right, thank you, Andrew. And last but not least is Axel Bernabe.
Yep,
all right, close enough. Well, I'll let you introduce yourself as well. Assistant Counsel for Health to Governor Andrew Cuomo.
Hi, good morning, everyone. Nice to be here with you today. So my role in the administration is to provide the governor with advice related to health, but over the last 4 or 5 years, I've been particularly focused on cannabis. So we have not yet introduced, well, we've introduced, but we have not yet passed our adult use program We're hopeful that'll happen in the budget in March and April of this year. But we do have a medical program and a hemp program, and we've centralized that discussion, sort of the hub and spoke that Andrew mentioned, in the governor's office, because there is so much overlap we find between some of the responsibilities in regulating hemp and CBD and cannabinoids, as well as the medical program. Our plan is to create a new office, an Office of Cannabis Management, which would centralize all authority related to cannabis issues in one place, at least for the foreseeable future, as the product starts to sort of enter the natural segmentation that exists nationally in dietary supplements and whatever else that path may be. But so it's a pleasure to be here with everyone, learning a lot, even from just this morning's panel.
All right, well, so to our panelists, although I'm not a panelist, I do, as legislators, we probably underappreciate our regulators and our state employees and our people who act in the private sector as well. I always tell people when I'm working on bills, I'm just the pretty face. And the rest of the work that really goes behind this, it's okay, it was a joke, it really does belong to the folks who are on this panel. But just by way of background, I'm State Representative Jonathan Singer. I represent a district about an hour north of here, 77,000 people in northern Boulder County. I also chair the Public Health Care and Human Services Committee, but also have the distinction of being one of only 2 state lawmakers that publicly endorsed the Yes on 64 campaign here in Colorado to legalize marijuana and treat it closer to alcohol. So it was myself, a pretty liberal lawmaker from Boulder County, and then a Tea Party conservative in the state Senate. And the good news about that is we're now friends on Facebook. But the interesting thing is once he was term limited, and I was just beginning my tenure at the state legislature at the same time. So when it passed, I was the only lawmaker left standing, so to speak, that was on the record supporting something. So my House leadership came to me and said, well, you wanted it, so can you please make this work? And the answer was, sure, why not? So here we are today, just a few years past 2012 now, and we're in a brave new world, so to speak. We've got many more states, almost a majority of states now on board with both legalized recreational and or medical marijuana. And so what I'm hoping to do is have more of a conversation rather than just a question and answer. But we're going to start with a few questions to see if we can get the conversation going. So to all of you, do you want to explain a little bit about how your state is regulating cannabis and or hemp, and in what stage of legalization you are? And then I'll hop to California, since we're fortunate to have 2 folks here from California to explain a little bit about the differences in your roles and whether or not you have a coordinated approach. So, so why don't we actually start with Lori and Nicole on that second question, and then we'll let Axel and Andrew chime in.
So I am sort of, in its most simple sense, Lori's support staff in the governor's office is how I like to think of it. But this is a new position created by Governor Gavin Newsom. He took office early this year, and he really wanted to have focused time, energy, and resources within his executive team to make sure that the state was really sort of meeting the demands of what we were seeing in real time and supporting our licensing agencies in doing that. Beyond that, there are 20 plus agencies and departments across the state of California working in this space. So really trying to keep that 30,000 foot view to make sure that from a regulatory perspective as well as a policy development perspective, we're addressing the issues that this industry deals with every day, like workforce and taxation, banking, so on and so forth. So I like to say I take that 30,000 foot view, but I work every day to support Lori in her work. So we are coordinated.
Yeah, and there's plenty of work to go around in California, so it's always nice to have somebody else helping, making sure the trains are going on time. But for me, I'm focused mainly on the Bureau's operations, making sure our regulations are working. In California, we're in, a year and 9 months of implementation. We first started issuing licenses on January 1st, 2018 for both medicinal and adult use cannabis. So we are now starting to see what's working, what's not working, and we've already made change. Even in the first year, we were making changes. So we're fairly committed to making sure that what we have in place, because the state is the base for regulation. So we're what we call the floor. So every licensee in California has to follow state regulations, and then our local jurisdictions then they can be more restrictive. They can ban cannabis, and then they could put their own rules in place. A lot of our job at the state level is working really also closely and coordinate with the local jurisdictions, like most of you have to do. In California, it is very challenging because we have so many, over 500 local cities and counties, and just trying to address the needs for different jurisdictions, whether it's up north in the Humboldt County, Trinity area to the city of LA. So we got a lot of work to do. We're all just starting to transfer our licensees into the track and trace system. So all of those things are what we're focused on.
And Andrew, Axel, any updates about where your two regulatory regimes are at right now to let our folks know where we're headed?
So we have a pretty robust medical program, probably historically been characterized as one of the most restrictive programs, and in light of some of the recent events surrounding vaping, that has turned out to be a bit of a blessing in disguise. We've had that program going since 2014, and in 2015 we started our hemp program, and we probably have one of the more restrictive hemp programs. Well, it depends actually how you look at that. We allow the sale of cannabinoids outside of adult use distribution systems, mainly because we don't have adult use distribution systems, but we do regulate the standards at which they're processed and manufactured pretty aggressively using federal law. So we have those two systems up and running, and we're very involved in that. So we're not hands off. And then in order to tie those together and introduce adult use, because it did seem a bit nonsensical to have both a strong, vibrant medical program and the legalization of every cannabinoid except THC in our hemp program and not address the adult use framework. So we created a law called the Cannabis Law, which I think is a bit unique in that it addresses all three programs comprehensively in one bill and creates a new section of consolidated law, which is not something you get to do every day. And that was proposed and is being discussed, and we're hopeful that passes in this budget. So we would go live on April 1st and then have to follow Andrew and everybody else, a lot of folks in this room, in starting that rollout. And we have some pretty specific ideas on how we'd like to do that. New York tends to be a little bit more centralized in the way we administer programs. And so that has implications that we're happy to discuss, and I'm sure we'll touch on.
All right. Last but not least.
So we've had a medical registry program in Michigan since 2008, and on the flip side, I think ours was probably the most liberal in terms of qualifying to be a medical patient. This is prior to having any sort of commercial facilities, in that you just needed a doctor's certification of having a qualifying condition, and with pain being one of those conditions used by 93% of the applicants, we quickly grew to 300,000 patients in the state. Since we've had regulated facilities in our adult use ballot initiative passed, we've seen that drop to about 270,000 now, and we expect that to continue to decline. But we didn't have a framework for commercial facilities until 2016, so that was 8 years of a market that started to bubble up and turn into a commercial market in those 8 years. And so we had over 400 facilities, well over 400. There were estimates of having over 300 in Detroit alone that operated in a gray area. And so we had the unique challenge when the law passed of trying to pull all of those facilities into the regulated market. And I have some interesting lessons learned for anyone that might have to face a similar challenge. And we still now are trying to push out unregulated facilities who now are still covered by a court order, and still have almost 30 of those operating in the state with no sort of oversight at all. It's just a free-for-all selling through those facilities, while we have over 300 regulated facilities operating now in a market competing with these unregulated facilities. And that poses a lot of challenge for unlicensed enforcement as well, when we have these odd barriers between who is supposed to be doing what. But we do have a fairly robust and restrictive licensure program for facilities on the medical side. As I said, we're up over 300 licenses now, but seeing challenges in having regulated supply keep up with demand in that medical market, and then expanding soon into the adult use market, where we go from a population of 300,000 or so patients to 7 million potential consumers, and trying to set up that framework as well. So we start taking those applications November 1st, and expect to see a great deal of participation in that market as well. And then in the hemp side, so as I said before, our agency regulates all things marijuana, but hemp is over in our Department of Agriculture. They issued within a couple of weeks 700 licenses for a pilot program to start growing hemp. And they have no standards for any sort of products that come from that. So they issue these licenses. They're supposed to be for research purposes, but they do not have the authority to set any standards for the products. So we are always advocating for similar standards as we have in the marijuana market for consumer protection, obviously. But as it stands now, it's sort of going to be a free-for-all in the short term for those CBD products that are produced in the industrial hemp market, and also trying to clarify then, if we have CBD products that are manufactured in our very closed, tightly regulated system, and they have CBD products, how do we treat those? And is it more important to have consumer confidence in certain types of products, but confusion over whether you are handling marijuana or something that's not defined as marijuana, when the product could be exactly the same? So confusion definitely reigns in that space, and we're going to need some legislation probably to clear that up. And we're working closely with the Department of Agriculture on that.
So you actually mentioned a couple of things, Andrew, that I thought were interesting. And while Colorado was the first state to legalize, and a lot of people say, well, what about Washington State? I like to remind people we're in the Mountain Time Zone, and they're not. So we at least beat them by an hour. And also got our regulatory environment set up a lot faster, partially because we were constitutionally bound to do so. I tell states around the country that just because Colorado was the first doesn't necessarily mean we'll be the best, and hopefully there will be lessons learned. Now, one of the things that Colorado historically has believed in is local control. We're very much a local control state. Our cities, our counties are where a lot of the power is derived from, and where programs are administered. And so what you see now here in Colorado is, while we do have a state marijuana enforcement division, our local governments have a lot of abilities to opt in, opt out, tweak, and change. Given that regulatory environment, a lot of states have hopped on board and also adopted a lot of local control measures, whether or not they were historically local control states. And so I'm just a little curious, in Michigan, are you seeing a lot of flexibility between the state and locals? Where are you seeing that flexibility? And can you share a little bit about your thoughts on, interagency cooperation? How is that looking right now in your state?
Yeah, we're really trying to be a resource for local communities. We do have opt-in provisions in the medical law and opt-out provisions in the adult use law. So we won't issue a state license, which is the ultimate authority to operate a facility in the medical space, without an authorizing local ordinance. But in the adult use space, we have to issue a license unless there's a prohibitive ordinance locally. So we have 1,773 municipalities by that definition in Michigan. So to get that word out to them and provide them guidance on how to approach this is incredibly challenging. Obviously, the bigger urban centers have attorneys and legal counsel and employees that are full-time to be able to address these issues, whereas some of the more rural townships, it's a volunteer basis. They meet once every couple of weeks. So for them to dive into this issue is incredibly complicated for them. And to get the word out to all of those places, there's only one of me, and there's so many of them. So trying to work through their associations to talk through their responsibilities. And ultimately, that's sort of their critical decision to make, is do we want in or do we want out? And then the state sets up the regulatory framework, the operational standards for the facilities. We do the inspections, have the ongoing oversight. But municipalities do have a little bit of control, not only in whether they're in or out, but they can limit the type of facilities as well. So we see a lot of them restricting or prohibiting retail establishments, but they will allow for cultivators and processors and transporters and labs, but they don't want the retail storefront. But in a clever twist in the ballot initiative for adult use, they shifted the tax distribution to be solely based on a prorated share of the number of retail facilities you have. So for all those communities that allowed medical cultivators and processors but had no retailers, they just lost their local tax distribution. So obviously that's a way to kind of cajole them into having retail establishments in the adult use space. But we only have, out of those 1,773 jurisdictions, under 130 on the medical space that have allowed for facilities. So when we look at questions of access in the medical space, out of the 83 counties in Michigan, we had 40 in which there wasn't a single jurisdiction that allowed for retail operations. So that creates some concerns about access for medical patients and obviously just tends to support then the black market within those counties. And we have over half of the municipalities now that have opted out of allowing or have prohibited adult use establishments. So I think we're going to have another question still of access when it comes to the adult use space, and we have a fairly robust black market operating in the state now. But municipalities, beyond opting in or opting out, also can control time, place, and manner, control by zoning where the facilities are located. So sort of broadly speaking, municipalities control where the facilities are, and then the state controls how they operate.
So that was a mouthful. No, obviously these are huge challenges. I want to switch to California briefly a little bit. So, Colorado was obviously in the first wave, joining places like Oregon and Washington. California is sort of seen as part of the second wave of cannabis legislation, at least on the adult use side. And so, my thought here, Lori, is what lessons did you take from Colorado, from Washington, from Oregon, good or bad? Which regulations were just straight up or close copy and paste, as opposed to, gee, we were so glad that Colorado went through these growing pains because we're going to do it better and faster and more efficiently and protect public safety in this other great way that, is just one of my regrets that I think about when I go to bed at night.
Well, as all of you know, we all have different statutes in place, so I think that's what makes it difficult to straight off copy, because that would be great if we could do that, but California with the voter initiative, it did make it challenging. We had a distributor model that was pretty unique from other states, where the distributor was the quality control, that they collected the taxes, they arranged for the testing. And so it was a challenge to get the product through the supply chain and put in regulations that would allow it to get through, efficiently and safely to the consumer. So I'm going to tell you, I think I remember my first calls to Colorado and Oregon and Washington, and I think you're just in a state of shock of like, what did I get myself into, and how am I going to get through this? And I think the biggest help that other states is just providing that support that you need at that time, because if I remember like the early days, you just don't know what to do and where to start first. And I think that's where I really took, what's the first steps? What are you, trying to make sure, it's so overwhelming at first. So that was very helpful. But a lot of things we looked at, testing regulations, both with Colorado and Oregon, and how we were going to set up our testing, especially how you regulated the retailers. I think there was a lot of concern on transportation of the product and security of the product. So a lot of those things we took and looked at what Colorado was doing, and of course looking at how we regulate things like some of these edible products, and making sure that I think we put in some fairly restrictive packaging and labeling requirements to make sure that California consumers were safe. So a lot of takeaways, but I don't think any of us can say I could look back and say, God, I wish I did this. Even with you guys having the first wave and us having the second wave, you still make mistakes. You still you're dealing with what information you have at that time. And as all of you know, it changes like daily. And so, you don't have all the information at hand. So it's easy to say now, a year, 8 months into implementation, we should have done this. But I think what we've been successful to do, and I think I learned this from Colorado too, is get engaged with the industry and your stakeholders early on. And that was probably one of the best advice I got from Colorado. Get out there, learn from the industry, make sure you're asking questions and listening to them. And to that, I think, served us well, having that engagement with the industry. And we continue to have those conversations and open the dialogue and be as nimble as possible with a real innovative and creative industry that moves at the speed of light. And I came from regulating alcohol that moved very slow. It was a culture shock for me how quickly things moved.
So before I go to my next question, I just want to get a sense from the audience, and I don't know if this happened in earlier sessions, but I'm going to do it anyway for my own education here. This is the audience participation part where you get to raise one of your hands and tell me how many folks here are from a state, I don't care whether you're industry or a regulator or an elected official, are from a state or from a country that has both legalized recreational as well as medical regimes already up and running. All right, good show of hands. How many are just medical? And how many neither? Oh, don't be shy. Okay, so a couple of hands. Okay, that's just helpful for yeah.
Before you move on, can I answer that?
Absolutely, yeah. No, take it away.
Just because we're the, I guess, Cannabis 3.0, if we use that analogy, and we relied very heavily on the folks in Colorado, in Washington, California, Alaska. We spent a lot of time on the phone, and everybody was extremely helpful and willing to talk about what they'd learned. Whenever I sort of talk, I like to point out that we're standing on the shoulders of some pretty impressive regulators, and we learned, and we came in at a time where a lot was changing, so we benefited. So none of what I'm going to say has anything to do with our vision or foresight, and everything to do with being at a certain place at a certain time. But the big things that concern us as we're rolling out, now that we have some hindsight, is the future of the medical program. I'll put 4 buckets, really: medical, hemp, vaping, and social equity. And I don't know that anybody's gotten those right. We started, like I said, from a really conservative medical program, and that got a lot of buy-in from our physicians. So we have as an example, we have a pharmacist at every dispensary. We have mandated formulated products that doctors can understand. We have really high testing standards, obviously, and so on and so forth. And it's gotten a lot of buy-in. And as Andrew pointed out, you see a bit of a collapse of the medical market when you go into adult use. And that's a big concern of ours, because we have some heavy users that are probably self-medicating, and we'd rather they do that in the medical program. So one of the things we could talk about as a breakout session, I guess, but is how do you safeguard that medical program? On the hemp side, we talked about Mexico just earlier, and we're talking about really the industrial commodification of a crop. 2% is actually an interesting number to set the THC level at. It'll give you a lot more cultivars that have higher production yields of cannabinoids, and you're talking about people getting into the fiber and seed business, which are going to be producing tens of millions of acres potentially of this new crop. And so that's going to be a wave of cannabinoids that we have to deal with as the regulators. And as Andrew pointed out, in Michigan, it's the Departments of Agriculture and Markets in New York that deal with this and don't necessarily have the expertise and are looking at this as a crop like the USDA is. And post-harvest, they don't want to know anything about it. So that's a big blind spot for us, and we're very concerned about that, and we'd like to regulate that. And then vaping is sort of obvious. It's a new mode of delivery that we all thought we understood. or at least pretended to, and then we realized that we don't. And so we're concerned about that, obviously. And then social equity, there are pioneers, California, in large part, that try it at the local level. But we'd like to try to solve that problem, mainly through access to capital and reserving certain number of licenses to folks. And I know people are struggling with that. But so that would be my list of things where I still think we have challenges as regulators, despite all the amazing work of Cannabis 1.0 and 2.0.
So along, no, I'm going to keep the microphone on you for a second now that you brought up 3.0. So thanks for putting the spotlight on New York for a second. So one of the blind spots, and I know California at the local level has been a pioneer in this, but certainly it was one of the blind spots we had in Colorado and in pretty much every other state, is this element of social equity. And so when I look at this, and the way that I frame it is that the primary victims of the war on drugs continue to be victims, right? So if you were good at dealing drugs, you're probably not going to be a dispensary owner because regulations forbid it now. Because you've gone to jail, you have a criminal record, you have a felony, there's something going on. At least in Colorado, that's oftentimes the case. We also see that there's a high density of dispensaries in socioeconomically struggling communities and neighborhoods that maybe don't have the same ability to zone out or create the neighborhood strife that would push out one of these dispensaries. And they're typically not owned by residents of those neighborhoods. And so we're seeing those struggles. We've seen them firsthand in Colorado. We've seen them in other places as well. And part of the idea here was to actually get rid of this component of the war on drugs. So that being the case, what is New York looking at in terms of social equity? What are you doing? Are there things that we can regulate, and where can we do better?
So that's a really complicated question, but I'm happy to kick it off. But again, the preface is that we are benefiting from what you guys have done and what California's done on a local level and all the things that have been tried and failed. And so we're really trying to jump off that starting point. So really nothing of our own doing. I mean, the social equity component has grown. I remember when I first spoke with Rick Garza of Washington State about social equity about a year and a half ago or so, and he was saying, well, we didn't do much by way of social equity in Washington, and he felt terrible about that. But then he explained that a lot of the tax revenue from the marijuana program was going towards providing affordable health care for folks that didn't have it. And right, so it's just a question of the debate changing, and the East Coast also having maybe a demographic that's more in line with this issue. And now federally, it seems to be a core part of the discussion. So it's really about, again, timing, political timing. But we heard that message, and so what we sort of break this down to a couple things. One is the most obvious, is the access to capital problem, right? So a couple of the models that came out of Oakland and other places were really ways in which you're trying to partner up industry and social equity applicants, but fundamentally you're trying to strike a balance where you're giving people access to capital but not depriving them of all equity and ownership, right? So it's really almost social impact investing at its finest. How do you strike that balance? How do you make sure that they have that ownership interest and they're not at the mercy of too many forces? But then it gets really complicated after that, because when you talk about social equity applicants, I mean, of course, like Canada, we don't have a prohibition against folks with a criminal record, especially for low-level possession offenses, from participating. To the contrary, the definition of our social equity applicant is someone who comes from a neighborhood that has been disproportionately impacted through high arrest rates. He or she or someone of their family has been arrested and has 70 or 80% of the mean income in that neighborhood. So we have a pretty tight definition of what a social equity applicant is. The corollary problem is that what you said is that some of these communities that have been devastated by the war on drugs don't necessarily have the know-how or the experience or the access to build a successful business. So we want to create an infrastructure and what we call the system architecture, which would allow people to prosper. So you'd want to limit the number of dispensaries. We actually proposed a 3-tier system, in effect a 2-tier system like alcohol, and Washington and Canada are the only ones that are doing that. And that's a very controversial proposition, right? You can't vertically integrate. But the idea there is, we have 3,300 licensed liquor stores in our state, and they survive as mom and pop stores. So is that a better model to ensure that social equity applicants have an ability to flourish and survive? So a lot of issues embedded there. It's a topic for a panel in and of itself, but we are really focused on that. It's really
panel
one of our.
happening at 12:15.
Well, there you
actually.
go.
So
Teed it up.
no, this is just a small teaser for the 12:15 working lunch panel discussion on social equity programs with moderated by Sean Coleman here in Colorado, and having folks from the Denver Office of Marijuana Policy, the City of Portland, City of Oakland, and City of Los Angeles. So for those of you who were just absolutely spellbound by Axel's take on this, there's even more time at 12:15 to take up this opportunity during a working lunch session. So thanks for queuing that up. I did want to hop over to Nicole because she's got something on her mind, but I'm going to, before you say anything, also hopefully you can dovetail into social consumption as well, because I think that is one of the things that we definitely didn't get to in Colorado fast enough. I just passed a bill this year, and we're almost 5 years into a legalized regulated marketplace at this point, with no actual regulatory framework for a social consumption matter until now. So take it away with whatever you were going to say, but try and fold that into my question.
All right, two parts. So to the equity component, I do want to point out in Proposition 64, it did not just legalize cannabis, it decriminalized significant portions of that activity as well and provided opportunities for expungement. And so we've seen third parties come in like Code for America that have been doing awesome work throughout the state. Now we're seeing that around the nation to do proactive expungement in a really innovative space that costs less to the jurisdiction to implement that, but more importantly, costs less to the individual who has to go through that process absent that tool, and pay for that process absent that tool. So I want to make sure I flag that, as well as within the tax structure that was encompassed within Proposition 64, there was earmarking of tax funds, and one of the components of that is a program called Community Reinvestment Program, where tax revenue goes towards communities directly impacted by the war on drugs, not for purposes of providing capital for cannabis entrepreneurs, but really to invest in things like reentry services, mental health care, important things that communities need to rebuild. We just allocated almost $29 million last week to that. But that is obviously a drop in the bucket of what needs to be done. So this is just one piece of that bigger puzzle. California has really taken, as you guys pointed out, an approach of encouraging locals to develop equity programs. We've seen some really great models in development in LA, in Oakland, obviously, in San Francisco, in Humboldt. The point of that is really that those jurisdictions know deeply what their communities need. And in such a large state like California, we want to make sure that we're fostering those conversations. These cities are our innovation labs. So we are doing things to incentivize those conversations. $40 million has been allocated to go to those programs. But we're also, to New York's point, looking at system infrastructure on the state level that can support equity applicants in their local equity programs. And that's an ongoing process that will be a forever process. So just wanted to flag those things. As far as social consumption is concerned, yes, I do think it's important to front load that. We're telling people it's legal to consume, but we also, I think, would benefit from telling them where it is appropriate to consume. The consumption challenge, when you think about the fact that individuals, renters, for instance, may not be able to consume in their residence, you cannot consume in public. All things that, could leave in tourists can't consume in hotels. So things that leave people sometimes in precarious situations, especially new consumers. So I think there is a benefit to creating a space to have a discussion about where consumption is appropriate, where it reduces youth exposure to that type of activity, and where it provides the consumer with the resources that they need to be an educated, responsible consumer in a safe consumption space. San Francisco has had consumption for a long time. We just saw West Hollywood open up a really innovative consumption cafe. It is not infused food. They've been very creative with how they have implemented that there. It's a challenging conversation, but it's a worthwhile conversation to make sure that you're front loading so that you're giving consumers a very clear framework for where they may consume and how they may do that responsibly.
All right. So I love talking about edible consumption right before lunch. That just seems appropriate. Jumping to the entire panel, and whoever wants to start with this is more than welcome to. We're going to do 2 last questions to the entire panel, but then I really want to make sure we get questions from the audience. So we've seen this massive paradigm shift across many states legalizing adult use cannabis, and given the groundbreaking shifts in hemp at the federal level, I've got a philosophical question for all of you here. So there are those that really believe that we should regulate cannabis in a special, distinct way. And a lot of others believe that we should be regulating cannabis in a way that normalizes it, or at least destigmatizes it and treats it like any other industry, any other product, any other time. So what is your perspective, or your state's perspective, if you have a boss, and how does that philosophy guide your work? Is it something that it's its own distinct bucket, or is it really something that deserves to be treated like any other commodity or product on the market today? And I don't know. I don't think we've heard from Andrew the longest, so I'm going to start with you.
Yeah, I've been as quiet as long as I can, so thank you. It's sort of a challenging piece to insert your personal philosophy when we're all implementing laws that are on the books, I think, in a lot of ways. And especially, I know a lot of states have ballot initiatives, and we do in the adult use space, so you're really implementing the will of the voters there and trying not to run afoul of that. But oftentimes, it's very challenging when our ballot initiative language is very restrictive in terms of how many words you can use. So in a lot of cases, there's not a lot of exposition that gives you the details that you're hoping for to try and figure out what the intent was. Our entire social equity program is built on one sentence, and then we're left to figure it out from there, for example. But I think it's then hard to treat it like it's not completely different from everything else. But our focus has been less around talking about marijuana and talking about businesses and treating those businesses like other businesses, and trying to provide wherever we can an opportunity to have a discussion with the regulatory body to normalize the business. So I think banking is the perfect example of that in Michigan, where not using banks is not a good idea. I mean, that to have cash flying around the streets is not good public policy. I talked to one provisioning center owner who had to buy an old bank just to store all his cash there, and then he transported the cash there every night. That's not how you run a business. So we've tried to provide an opportunity through our agency for financial institutions. So just getting out and sharing information about the regulation of the products and how we treat it, trying to destigmatize. And I think that it's a different conversation coming from a regulatory agency versus an industry operator when you're dealing with some of those other highly regulated spaces. But we actually provide an opportunity for banks to get information from us on the backgrounds of our applicants and licensees, as well as getting access to state level data, so some of our metric data and some comparative analysis, and so that they can feel comfortable with banking the industry. And that's been an area where we've established good partnerships with our banking associations and some of our financial institutions to be able to provide a roadmap on how they can get into that. So I think in that way, we look at it as businesses, and we talk about them as businesses and try and downplay in some of those conversations that it's marijuana. And we're just talking about a regulated business, and a highly regulated business at that.
All right. We'll just keep going in alphabetical order. So Axel?
So this is not a question you want to ask. My background is antitrust economics and law. So, right, so I tend to unpack a question like that and say the way we've been looking at it, to be perfectly honest, is there are at least six markets that we're talking about when we're talking about cannabis. Really quickly, you have the industrial use, you have food, you have health and wellness dietary supplements, you have this new kind of alcohol-like THC recreational market. You have a medical market, but that's not really pharmaceutical because it doesn't have FDA-approved drugs. And then you have pharmaceutical. So those are six markets. So each of those markets has existing regulatory frameworks. So we don't have to treat it like anything else, except maybe for alcohol and that THC, where we could treat it like alcohol. But that, at the very least, we need to control, because we all agree it can have the potential for abuse. But even in the other six markets, or the other 5 markets, the existing regulatory approaches are not perfect, right? We know the FDA isn't coming into the dietary supplement world. We know vaping crosses over different ones of these markets. We know that as a crop, you still have to test so that you don't run hot. So that's not your conventional commodity crop. We know that the medical program is not producing, FDA double-blind randomized trials and is doing a sort of plant-based approach to medicine, and that's a whole new kind of FDA light system that we have at the state level. So I'd love to be able to say personally that we're overdoing it and we're overblowing the regulation of what is just a plant. But unfortunately, when you look at the applications and the demand side, and you look at what the products are in the ultimate stream of commerce, you have at least 6 applications that each have existing complex regulatory frameworks. So we have to at least have those in place, and then we have to tweak them to apply to this plant. So I think the answer is squarely in the side of we're doing our best, but I think we have to regulate the plant.
Well, you're right. I shouldn't have asked an antitrust attorney, but no, that was very helpful. And whoever wants to take it, Lori, Nicole, whoever wants to take it away next.
Yeah, I don't know that I have too much more to add. I think Axel and Andrew did a great job. I mean, obviously, I think from California's side, we want to normalize cannabis businesses. We want, we keep saying it's legal now, but unfortunately, our cannabis businesses face different challenges than our other businesses that we regulate in California, like access to banking, the fact that we track it like no other product. We track it from seed to sale, the restrictive testing requirements, and making sure every batch is tested before it goes to retail. So as much as we want to normalize it, I think right now our statutes and regulations don't allow us to completely normalize it. I think that's going to change over time. I think, I know when we started this journey 3.5 years ago, a lot of the comprehensive and strict restrictive regulations we put in place was a lot because of the federal government and the Cole memo, and all of us worrying that if we didn't have this strict regulatory structure in place, the feds may come in. I don't know that we think that anymore. It's really changed in just the last 3 years, and maybe I think we're looking at where can we be more business friendly and still ensure public safety, consumer safety. And I think we're having those conversations, and we continue to have those conversations. So I think you'll see that change over time.
When I talk to industry operators about the regulatory environment, I try and offer them some reassurance by saying, I think, and probably other states approach it the same way, this is the most restrictive we're ever going to be, but we need to be sure and get answers to some of these questions to ensure we don't create any public health crises through just a lack of understanding on our own part. So, we have a lot of things in place, and as we see that it can operate and we start to see some of the black market diminishing, then maybe we can start to open it up so we can treat it more like another type of business. But until we get to that point where we have some assurance that the things we're doing are working and that the public isn't negatively impacted, we have to very tightly control things.
Great. Any other thoughts, Lori, before we jump on, or Nicole? No? Okay. All right. Wonderful. So before we jump into questions for the last portion of this, if this is, well, as someone who has a regulatory mind, this is like a question that's like choosing between your children here. But this is your time to shine here. In each of your states, you've gotten some things immensely right. What is the one thing that you are most proud of? Start over there this time. I know you have so many things to be proud of. Like I said, it's like choosing between your children, but or one thing you're most proud of that you would like this audience to know about. So maybe we'll frame it that way.
Well, this is a tough question because I hate to pat ourselves on the back, because as soon as you do that, you go back to California and something goes horribly awry. So, I will go back to 2 things. I think we're still trying to figure out if we got our testing regulations right, but I think for the most part, we've done a really good job with those testing regulations and making sure folks are getting safe cannabis. So I'm particularly proud of that. Also, also are, and I'm not sure the cities and counties in California will appreciate this, but how we looked at delivery. In California, we looked at delivery. If you get a state license, you can deliver anywhere in the state. But that came with controversy, right? We are now getting sued over it, so that's all I'm going to say about delivery. But I think what we really got right, and I spoke about this earlier, is our engagement with the industry and that continued engagement. I don't think you can say enough. Coming from even alcohol, we engage the industry, but not at the level we do that we do in California. And really, I think California has done a really good job. All of the state agencies that we work with, we do have a common. It's a different atmosphere. It's not this us against them mentality. It's really like, how do we make sure the industry is successful, but also ensuring public safety? And we come at it at that point of view, and that's everybody at the state level. I've never seen anything like it, the coordinated approach, because really all of the state regulators really care about the success of this industry. Nobody wants to fail, right? None of us do, and I think that's pretty refreshing. I like to say, I thought I knew about leadership when I got to cannabis, and I realized I didn't know anything. It's leadership boot camp. That's what I say every day. And I continue to learn, and I think we have to be humble in our approach, that we're going to continue to learn, and we need to continue to ask questions to make sure we're doing the right thing.
Yeah, I'm glad you brought that up. I think the upfront stakeholder process in Colorado is probably what has yielded the most fruit. It's more of a process answer than an outcome answer. If you were to ask me in Colorado, which I'm now asking myself as the moderator. And, when we brought the opponents and proponents together, we brought concerned parents together with DAs and defense attorneys and, medical marijuana patients and medical marijuana dispensary owners, and had this very long, painstaking process. 90% of the recommendations that these work groups came up with actually became law. And when you're 90% on the same page with anybody, it's a pretty good day. So other shining moments, shining examples you'd like other states to know about?
I just want to give a nod to the state agencies and the staff. They sort of have, to Lori's point and piggybacking off of that, approached this with a very innovative spirit and relentless optimism. And they've had a monumental task to turn over an extremely large, unregulated industry in California that has been in place for a very long time in an unregulated or quasi-regulated space in a very short period of time. So that approach has been so important. It has been recognized by stakeholders, I think, both on the local level as well as within the industry. And I would encourage everybody to take that approach as well. I think we're seeing that pay off. There was a poll that came out yesterday that shows public support for this exercise is only increasing. Jurisdictions, individuals in jurisdictions that don't currently have retail are supportive of putting retail in their jurisdiction. So we are seeing that feedback loop show positive results.
All right. Andrew, Axel, anything else?
Well, nothing else, because Lori stole my answer. But nonetheless, I hopefully those of you that are newer to this process will appreciate the fact that I was going to say collaboration as well. I wrote it down, so I had that answer ready. But that is of critical importance, not only engaging with the industry, but other partners as well, public health officials, community members, and community leaders when you're implementing a program. And I think that's been our greatest success. So when we put out our first set of adult use rules, I was speaking at a industry group event, and they actually gave us applause for the regulations we put forth. And I wasn't quite sure how to take that, because normally you want to make the industry mad with your regulatory program, but I thought it was an interesting nod to the way that we've collaborated in terms of how we develop the regulations, and we continue to do that on an ongoing basis as well. So we still, to Lori's point, put all these people in the room to talk to each other. So we have to have quarterly public meetings where we update the public and any stakeholders who are interested in what's going on with the regulatory program program. But at those meetings, we bring together then a small group of 15 to 20 people and make sure we have good representation of the industry, of the public, of community leaders, of public health officials to talk about some of those topics. But so they can talk face to face and they can hear the counterpoint. So we're not always the ones trying to explain to them that there's a counterpoint to the points that they're trying to make. But that collaboration is absolutely critical. And everyone's learning together. And as you all know all too well, industry moves a lot faster than government can respond. So the more you cooperate and collaborate with them, the more you'll know about where they're heading so you can stay ahead of some of those burgeoning issues.
All right. Axel, any other thoughts?
No, I mean, I meant it when I said we borrowed and are borrowing heavily from all the our predecessors. So I don't know that we did anything particularly unique. I guess the only exception would be something like regulating excipients in the medical program, something that narrow. So we require pharmaceutical-grade excipients in our medical marijuana products, and that's turned out to be a very lucky thing for us. But really, I mean, we're just trying to follow the Colorado model, the advisory board. We had some of your consultants come in and tell us that stakeholder engagement's key. So we're hopefully going to roll that out, but no, I don't really have anything to add.
Okay, well, let's go to the audience then. I don't know if we have a roving microphone anywhere because I'm partially blinded by these lights, but I'm going to look for some. Okay, we have a roving microphone in the back. I see a question up front, and we'll wait till the microphone gets there. And if you just want to say, if you want to share, who you're from, who you're with, and proceed with your question, and if you want to direct it to the whole panel or to a larger group.
My name is Kevin White.
We can hear you just great, Kevin.
My name is Kevin White, and I'm with Can It Make a Difference? Just a quick comment. So obviously, social equity is a big concern within the industry, rightfully so. My bigger question is in regards to corporate social responsibility. There's obviously a disconnect, or maybe it's not obvious, but there is a disconnect between the nonprofit sectors in legalized states and the cannabis industry and regulators as a whole. I wanted to know, obviously there's a national trend in municipalities taking on some of that opportunity to build it into their licensing process. From a regulatory standpoint where you guys sit, how do you look at the nonprofit sector or incorporate the nonprofit sector into your legislative process?
All right. Anyone want to jump off into that one about looking at the nonprofit sector? Or if there's a clarifying question for our... All right, no one's biting at that one.
Do you want me to clarify a little bit?
So yeah, I'll cue it up a little bit. So is what you're asking then in terms of are you asking about would-be dispensary owners or product manufacturers that are attempting to get a 501c3 nonprofit status and try and enter into the market? Or are you talking about marijuana industry making donations to the nonprofit sector or participating there? Where are we going?
That's part of it. So I'm not talking about cannabis-specific nonprofits. I'm talking about the general nonprofit sector. So anything from animals to veterans. A lot of these nonprofits are uneducated as far as what they can do, and there's a big gap in education as far as whether they will accept or can accept donations from the cannabis space or even support from the cannabis space. Likewise, cannabis companies, for the most part, some are doing very well with community support and things like that, but there are others that don't really know what they can or can't do. And in relation to 280E, because they can't take the tax deduction, I'm curious to see what you guys do around that, or if that's a consideration in legislation.
Yeah, I'll just respond as from Colorado. I would say that the majority of nonprofit industry, or a huge portion of it, is now much more comfortable with it today than they were prior to really prior to even a couple of years ago. I don't know if we're giving any specific guidance, but people can always call up our marijuana enforcement division and double check and sort of run it through the run it through the traps. What I would say is that how many of our larger dispensary chains have been able to make community connections is by, prior to a ribbon cutting, going, you know what, we've identified these 2 or 3 nonprofits that have done a great job in the community. We'd like to make a connection with you. And even if a donation isn't made, there's a conversation that happens. And hopefully that conversation yields some fruit that creates better community buy-in. I don't know if anyone else has any other thoughts. Andrew?
We do have a specific provision in our regulations that allow for cannabis businesses to make donations and run and get engaged with nonprofit programs, but it is restricted to not include programs that are targeting youth because there is such an emphasis on not engaging youth and advertising toward youth. So we do have that restriction. And then also in our social equity program specifically, and I stole this directly from Sean in Massachusetts, I believe, we require all of our licensed businesses to have their own social equity plan. It's not a regulatory requirement in that there aren't certain things they have to do. We're trying to sort of embarrass them into doing something good by publishing those online and publishing their updates so everyone can see what their plan is and then their own update in terms of how they're meeting that plan. So we're hoping that's going to encourage their interest in impacting those specific communities. Even those businesses then that aren't in a part of the state that has a qualifying social equity community by our definition, that they're still required to have some kind of plan that we'll publish. So we've already heard from some that said they're going to submit a blank sheet of paper and said, well, I'm going to publish it online then to draw attention to it, and we'll see how that works for you.
I've seen some art that looks like a blank sheet of paper and it sells pretty well. So we'll see. Nicole, you had something?
That's actually an interesting point. That's something San Francisco adopted as part of its regulatory framework, that very same approach, which was we required at the time, still required to this day, retailers to provide a social equity plan that meets sort of 3 targets, and it was very broadly defined so they could fill that in. And you saw a lot of engagement with community nonprofits as part of those deliverables, and that was published online and is tracked regularly and updated regularly. So really holding them accountable to the commitments they made. But with that said, on the state side, there have been conversations around, well, one, the state does allow for donations by licensees in the context of the medical framework. But with that said, there have been additional conversations above and beyond that on the legislative side, most recently around compassionate care and providing free cannabis to low-income medical patients. That bill did successfully make its way through the legislature and is pending before the governor, so I will say nothing beyond that. But it has definitely been a regular topic of conversation multiple years in a row, and generally, something that we encourage those conversations to happen.
All right, so we've got about 10 minutes left, and so I'm going to hop and see if there's other questions, and I know I'll just commit our panelists to being willing to stick around through lunch, even though I haven't asked them yet. So any other questions from the audience? I'm seeing, we've got a microphone up here, so
it's on.
Fire away.
My name is Brad Rowe from Avenue Muni Services out of California. I'm also with UCLA Luskin School of Public Affairs. Had a question with regards to labor, and I was wondering if any of the panelists could address what are some big wins any of you have gotten either in stimulating good job opportunities or cooperating with labor in ways that you're particularly excited going forward that are going to help future job opportunities for people in your states?
And just as a clarifying question before you put the microphone, we're talking about organized labor, unions, or just in general?
People working in the industry,
workforce.
Right, exactly. Induced employment, other things that you found particularly exciting.
All right. Who wants to take that one away?
See,
Go for it, Lori.
you're asking tough questions here. So for California, we do have, as you probably know, any cannabis business that has 20 or more employees have to have a labor peace agreement and engage with their labor local union. And so, the hope is that's going to provide more jobs and more job opportunities for people in the cannabis industry. And I think you're just seeing in general, as some of our folks, not everybody in California, whether you're a cultivator, manufacturer, or retailer, we realize that not everybody can make it through regulations and have the capital necessary. And we are seeing really at the private level, businesses cropping up that are training people to give them job skills in the cannabis industry, helping them become good business owners. So I think you see in California a lot of private organizations stepping up and filling those roles, and that's been very encouraging.
Anyone else on the workforce development side?
Yeah, this one's a bit more aspirational because, again, we have it in the bill, but it hasn't been rolled out yet. But some of it's practical. So I'd answer as sort of three-part. One is workforce training and development initiatives. Two is incubation, and especially in the context of our social equity programs. And three is a fun, labor anecdote. But so on the first, we do have a number of state colleges and non-state colleges that are getting into the business of training workers in the cannabis space and setting up programs, technical programs, grow programs, agricultural programs, and we're trying to coordinate that through our state workforce development board, and that's an interesting initiative. When it comes to the incubation, one of the biggest problems with social equity is getting folks in the door, so community outreach, getting them in, getting them trained on how to run a business, and getting them trained on how to apply for a license and remain viable in the marketplace. So that's a bit indirect, maybe, answer to your question, but our bill did commit the state to outreach, incubate, and train a lot of folks in order for them to be successful. So that I would consider a sort of labor angle. And then a fun anecdote was, I think one of my memorable experiences was sitting in front of organized labor and having a philosophical debate about whether, because we're proposing a two-tier system, so we break the vertical integration. We have the same kind of requirements California does when it comes to size over 20, I think it is. You have to have you have to have a labor peace agreement. But the question was whether the three-tier model would prohibit unionized labor from creating good jobs for vertically integrated entities versus mom-and-pop stores in the liquor business, for example, where it's often family-run and don't have labor protections. And so the question was, who is more progressive in their view? Is it small businesses that don't have union protection or large vertically integrated entities that have strong labor agreements? So I leave that for lunchtime conversation.
We'll chew that one over. All right, I see another question here.
Thank you. My name is Brian Scott. I'm the Assistant City Attorney for the City of Las Vegas. Lori, this question's for you. I won't ask you too much about the delivery service, but we're having issues with tribal issues with regard to the tribes, even though we don't regulate their on-reservation sales of marijuana. We are having experiences with them now having delivery services that we've not approved nor have we authorized. Have you had any issues with any tribal issues with regard to delivery or any kind of marijuana issue?
Yeah, so the tribes engaged us early on because they wanted to, we have a lot of tribes in California, and a lot of them couldn't get involved in like the casinos and things because of where they're located, but they're perfect areas for cultivation and manufacturing. So we haven't had a lot on the retail delivery front. We have just recently in the last couple months issued cultivation and distribution licenses for not to the tribe itself, but they are what we're seeing mainly in California. They're more like the landlord, and they are leasing their land out to a licensee for cultivation or distribution or manufacture. But that's so we're on the early stages on that, but we're not seeing a whole lot of delivery at this point. But if a tribe wanted to if they had somebody that wanted to do something like that, they are required, they would have to follow all the state regulations when it comes to retail, and we have it in our regs, certain things that they would have to do if the tribe is getting a license versus if they are really just the landlord and they are leasing their property out.
All right, any other thoughts on the tribal question? That was an interesting one. Actually, I haven't heard that one before. Yeah, Andrew.
Not necessarily about delivery services specifically, but we've tried to engage with the tribes, and we think that the 12 tribal nations in Michigan will eventually have some form of cannabis operations on tribal lands. But at this point, they're really providing a lot of their primary focus to this point has been providing financing for state-regulated facilities. With the absence of banking relationships, as we've discussed, even depositing money, but they certainly aren't getting small business loans. So it's all private equity funding, and the tribes have started to get into the industry that way by acting as the financial institution, if you will.
Okay. Other questions? All the way? No? Anything else on this side? Oh, got a question over on my far right.
I think this is going to be our last question before we break for lunch.
All right.
And I'll make it easy for that. I'm Pat Davis from New Mexico for the Governor's Legalization Commission. And we're one of those states that's looking at doing this here in the next year or so. And so maybe just really quickly down the line, we heard of what you're really proud of that you did. I wonder if you'd share for folks that are looking at this again, like what is that, oh my God, I would never do that again if I had the chance, sort of moment. And especially we talked about opt-in and opt-out right off the bat. I'd love to hear some of the, really quickly, like if you had it to do all over again, would you allow localities to do that?
Okay. Well, on that positive note, or word of warning, where should maybe we'll put it more politically correct, where should states tread lightly?
I'll speak to that issue, mainly because in California, the local component of Proposition 64 was necessary in order to pass Proposition 64. But with that said, I think that there could have probably been more incentives built into the framework for locals to participate, just outright incentives for them to participate, thinking about the tax structure, for instance. But with that said, we're still looking at that since we have a quarter of the state participating, and we'd like to see everybody opt in. So.
All right. Anyone else? You got it all right the first time, right? So.
I will say the local control, I think, becomes a political issue. If you want to pass legislation, you almost have to have that. So I don't know if that's avoidable altogether. And I think we've had a good balance in the state. I think our biggest lesson learned is if you have a presence of unregulated commercial activity, to be very thoughtful as to how you view that moving forward. Because we're still stuck with, I think I said this before, almost 30 unregulated facilities that we have to allow to continue to operate. And we just weren't very thoughtful. We assumed we would just set dates certain at which they needed a license or they'd have to stop, and it just leads to lawsuits. And I'm sure all of us have experienced a lot of litigation related to these laws. And I think it's impossible to write laws or regulations that are so perfect that you aren't going to create some gray area that has to be settled by the courts. But to really think through if there's a pathway for those people that were operating in this gray space or even the black market space to get in, that you're very thoughtful as to what those parameters are and you stick to them and don't accidentally. The situation we created was providing what appeared to the courts to be a roundabout way of authorizing that activity and therefore an inability to stop them from doing that even after we'd made a decision for some period of time, and we're constantly embroiled in lawsuits related to that.
I'm just glad no one said show up at this panel. Any other thoughts from New York, California on what you would do differently or wish you had done better?
We're not quite there yet, so.
Okay, well, look forward to that. All right, well, with that being said, I want you to join me in a round of applause for our panel and for ending on time. And we look forward to many more great conversations after this.